name is student Dr. Bridget Wynn.
Hi, nice to meet you, I'm Sean.
Nice to meet you. All right, so what brings you in today?
So I've been having some really bad pain right here on my left foot, and I want to see what's wrong with it.
Okay, all right, so let's take a look at that. So you said there's a pain right here. Did it happen from any kind of event or activity?
Not that I know of.
Not that you know of. No. And you said just right here on the medial side of your left foot, like this mid-tarsal area?
Yes.
Okay. How long has it been happening for?
About 3 weeks.
3 weeks. And how would you describe the pain? Is it sharp? Is it dull?
I'd say it's dull.
It's dull pain. Does it radiate anywhere?
No.
No, just in that one spot?
Yep.
Okay. Is there anything that you do that makes it feel better or worse?
I'd say it feels better when I lay down and I put my feet up, and it's worse whenever I stand on it.
Okay. Does it feel better or worse throughout the day or at night? Is there anything?
Probably feels worse during the day when I'm putting more weight on it.
Putting more weight on it, okay. And on a scale of 1 to 10, how would you rate the pain?
I give it a 5 right now that I'm sitting, and probably an 8 if I were to stand on it.
Okay, so that's pretty bad. So I'll ask you a few more questions about your medical history, and then we'll do a physical evaluation to figure out what's wrong. Have you ever been hospitalized or had any surgeries?
No.
No. Have you had any major illnesses as an adult or a child?
Nope.
No. Are you up to date on your immunizations?
Yes.
Yes. Okay, awesome. Do you take any medications?
I do not.
No. Do you have any allergies?
No.
No allergies? Have you had any blood transfusions?
No.
No. And patient is alert and aware? Okay, so a little bit about your social history. Are you married?
No.
No. Are you sexually active?
Yes.
Yes. Okay, multiple partners, just one?
Just one.
Just one. And are you practicing safe sex?
Yes.
Yes. Okay. A little bit about your sleep. Are you getting good sleep, and for how many hours?
Yeah, I'm getting pretty good sleep. I'd say average 7 hours.
Average 7 hours. Okay, that's good. Do you smoke, do drugs, or drink?
Do not smoke or do any drugs. Say I have a couple of beers a week. Probably.
A couple of beers a week, okay. And how would you say your diet is?
I'd say it's pretty good.
Pretty good.
Yeah.
Do you exercise?
A couple times a week.
A couple times a week, that's good. What do you do for work?
I'm a software developer.
Software developer? Okay, so you're not standing on it all day long?
No.
No, okay, that's good. Do you have any pets?
I have a dog.
You have a dog?
Yeah.
Okay, awesome. What kind of dog?
It's a pit lab mix.
Pit lab. Oh, that's cute.
Yeah.
And then have you traveled outside of the U.S. or outside this area recently?
I have not.
You have not, okay. In terms of your family history, so your parents or your siblings, do they have any major illnesses I need to be aware of?
No.
No? Okay, awesome. So we're going to start with your physical evaluation. So just stay there. I'm going to take your pulses.
All right.
So first is dorsalis pedis. All right, it's palpable, 2 out of 4. And we'll do this side. Right side, palpable, 2 out of 4. This is posterior tibialis, so I'm going to do both sides. Okay, left side, palpable, 2 out of 4. Right side, palpable, 2 out of 4. Now I'm going to do your popliteal, so that's going to be about behind here, so I'm just going to grab around. And this left side is palpable, 2 out of 4, and right side, palpable, 2 out of 4, perfect. So I'm going to test your skin elasticity and turgor, so I'm just going to do a little pinch, make sure the skin bounces back, and it does, that looks good. Temperature from leg to feet is warm to warm on both sides, and we do see hair growth on both legs and both feet, perfect. So now I'm actually going to have you lay back and scoot back so that your feet are just at the edge of the table. I'm going to test for your capillary refill time. And we're going to test each of your toes and make sure that they return back to normal in 3 seconds, which they all do. Perfect. I'm going to look at your skin and see if there's any major wounds or cuts or anything, any lacerations. I see nothing there, nothing on the foot. I'm going to look in between your toes for any macerations. Okay, and I I do see the red spot that's inflamed that you were talking about. This side, skin looks good. Okay, no cuts, no lacerations, and no macerations in between the toes. Okay, I'm gonna do a little quick check at all your nails. And those all look good. I'm gonna look at the bottom of your feet. So I do see where it is red and inflamed over here, and some heel callus, but no ulcers, no cuts. Same thing over here, just a little heel callus. All right, I'm gonna lift your leg up and I'm gonna check under. And we see no open cuts and no wounds. And then this side, no cuts, no wounds. Perfect. So I'm gonna do a musculoskeletal test now. So wherever my hands are, you're gonna try to push them away. So push your feet towards your head. Perfect, strong. Now push away, strong. Okay, push out, strong. And then push in, strong. Perfect. Okay, now I'm gonna go through range of motion. So I'm gonna look at your first right here. So that joint is intact and looks movable. Okay, so now your mid-tarsal joint is intact. And now subtalar, just relax your foot. Perfect. Joint is intact. So now I'm going to test out your ankle. So I'm going to put you in subtalar neutral. So right about here. And I'm going to push up. And I'm going to dorsiflex your foot. So I'm going to push towards you. Okay, so it's a little tight, but joint is still intact. I'll have you bend your knee. And I'm going to move it. Perfect. So we see that go a little bit further back. So that means that is good. We do the same thing on this side. So first ray, intact, 1-to-1, mid-tarsal. Perfect. Joint is intact. Subtalar, so just relax your foot. Perfect. Intact. And then I'm going to dorsiflex you after putting you in subtalar neutral. Okay, perfect. And then I'm going to press against you. Okay, so it moves back. That's good. Joint, ankle joint intact. And I'll have you bend your knee. Perfect. So that does move back a little bit further, so that's good. Range of motion, normal and intact for all of your joints. Next, I'm going to do a neurological test. So we're going to go through a couple different ones. So first is the Weinstein monofilament. So I'll have you look up a little bit. So basically, it's just this. And I'm going to touch it. And you're going to say yes if you feel it, and don't say anything if you don't feel it. Have you close your eyes for this?
All right. Yes. 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 Yes.
Okay.
Yes. 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 Yes.
Okay, perfect. Next up, I'm going to do a sharp dull test. So you'll tell me if you feel sharp or if you feel dull with your eyes closed. I'll give you an example. So this is sharp and this is dull.
All right.
Okay, so
Sharp, dull, dull, sharp, sharp, dull.
perfect. Okay, next up, I am going to test your proprioception. So basically, I'm going to move your toes. You're going to tell me which toe, and then if I move it towards your face, that's up. If I move it away from your face, that's down. Okay?
All right.
So keep your eyes closed.
Pinky toe up, big toe down, toe next to the big toe up, toe next to the pinky toe back up.
Up. Okay, perfect. Thank you for that. And then next up, I'm going to do a vibratory test. So basically, I have this tuning fork, and it vibrates. I'm going to put it on your bone, and then you'll tell me if you feel vibration, and then when it stops.
All right. Feel it, stop. Feel it, stop. Feel it, stop. Feel it, stop.
Okay, perfect. Next up, I'm going to check your Babinski sound, so just don't move, and I'll just move my thing along your foot. Okay, perfect. All right, if you sit up, I'll test your reflexes. So
Alright.
you just come towards the edge of the table. So first we're going to do your patellar. Perfect. Perfect. And then your Achilles. Perfect. Perfect. So all your reflexes are intact and symmetrical. So let me just take a little look at this infected side, or this painful side, I mean. And I do see inflammation here, and what I suspect is a hallux valgus or a bunion. And so that's something that may need surgical treatment, but for now we're going to try to treat it as conservatively as possible. For today, I'm going to send you home with a prescription for some ibuprofen. We'll do 800 milligrams, and you'll take it up to 3 times a day whenever you feel the pain.
Okay.
Right after this, we're actually going to go get an x-ray, and we'll follow up in about a week. So I'll be your continuing care. So whenever you're done with the x-ray, they'll give you an appointment, and we'll come back in a week and I'll check you out. For now, we're going to look into just icing this, keeping it elevated when you can, and maybe using a warm towel to help that inflammation go down. As far as things that you can do to kind of prevent it from getting worse, or from preventing it on the other side, is looking into like proper footwear that makes your foot fit perfectly in, and having kind of a wider toe box so that there's more space for this bunion. Do you have any questions?
No, I think you covered it all.
Awesome. Well, thank you so much for coming in. I'm sorry you're in pain, but we'll see you again in 1 week.
Alright, thank you.
It's nice meeting you.
Nice meeting you.